Thank you, Mr. Speaker. Again, I ask the clerk to report resolution number 43 and read by title only, please.
Clerk, please report.
House Resolution 43, a resolution declaring October 9th, 2022 to be Pandas and Pans Awareness Day. Representative Prunty.
Lady from Muhlenberg.
Pediatric autoimmune neuropsychiatric disorders associated with streptococcal infections, or PANDAS, and pediatric acute onset neuropsychiatric syndrome, or PANS, occur after an infection, most commonly a strep infection. However, current research indicates that other bacterial, viral, or environmental irritants can also cause persistent symptoms. A child's immune system misdirects its response, and the reaction causes a process of inflammation to occur in the brain. The symptoms can vary from child to child, but the onset is sudden and dramatic. It is often misdiagnosed and untreated or undertreated due to part and lack of awareness of the condition, both in the general public as well as among healthcare providers. Researchers have begun to substantiate that PANDAS and PANS involve a misdirected autoimmune process that affects or weakens the blood-brain barrier, and the inflammatory process irritates a region of the brain that manages a variety of functions such as movement, cognitive perception, logic-based thinking, emotions, and the endocrine system. Treatment varies according to the child, but may include antibiotics, steroids, intravenous immunoglobulin or IVIG therapy, plasmapheresis, cognitive behavioral therapy, and anti-inflammatory medications. The National Institute of Mental Health and other scientific and medical entities are currently engaged in research and testing on how to most effectively treat PANDAS and PANS to try and determine practice guidelines for the diagnosis and treatment. The purpose of this resolution declaring October 9th, 2022 as PANDAS and PANS Awareness Day is to help raise awareness and education among medical providers, school personnel, and providers of mental health services. It is here in Kentucky, and the numbers are growing every year, if not every day. The common thread parents say is their perfectly normal child suddenly becomes obsessive-compulsive. They will only eat one thing at a particular time of day. They wonder where their child went. A copy of this resolution is being distributed to the Secretary of the Cabinet for Health and Family Services, local health departments, health care facilities, mental health providers, and the Commissioner of the Department of Education for distribution in schools and school personnel and among teachers and parents. Mr. Speaker, I move adoption.
Without objection, so ordered.